Hello and welcome to the TheDocTab. My name is Dr. Lijoodi and today we shall be discussing supergonorrhea. Gonorrhea is a venereal disease that is caused by the gram-negative bacterium Neisseria gonorrhea. The risk factors for contracting gonorrhea include having multiple sexual partners, exposure from a sexual partner who has gonorrhea, newer sexual practices including homosexual activity among men, early sexual debut, sexual intercourse under the influence of drugs, and history of previous sexually transmitted infections. The transmission of Neisseria gonorrhea can occur in two ways, either horizontal transmission or vertical transmission. Horizontal transmission usually occurs when there is sexual contact between a person who has the disease and another who doesn't. Vertical transmission occurs when an infected mother passes the bacteria to a child during childbirth. So what exactly is supergonorrhea? Supergonorrhea refers to multi-drug resistance gonorrhea that has high level of resistance to current recommended antimicrobial therapy for gonorrhea, including resistance to penicillins, sulfonamides, tetracyclines, macrolides, and fluoroquinolones. The emergence of supergonorrhea has been attributed to three main factors, including over-the-counter use of antibiotics, use of low-quality antibiotics, and overuse of antibiotics. Genetic mutations in the bacterium have also been attributed to resistance to current medications. Emerging sexual practices, including anal and oral sex, commonly observed among men who have sex with men, leads to the interaction of gonococci with other bacteria of the normal flora that lead to the development of resistance. Following infection, a 2 to 7 day incubation period precedes the development of clinical manifestations. Women are asymptomatic 50% of the time, but when symptomatic, the signs and symptoms include dyspareunia, which is pain during sexual intercourse, dysuria, which is pain during urination, vaginal discharge, which is usually greenish yellow in color, and intermenstrual bleeding. Infection in women may progress to a more severe disease known as pelvic inflammatory disease. The most common clinical manifestation in men is urethritis, which includes dysuria and urethral discharge. The urethral discharge is initially a serous fluid, which progresses to become a profuse, purulent, blood-tinged secretion. Among neonates who are infected with gonorrhea, the clinical manifestation is ophthalmia neonatorum with eye pain, redness, and an eye discharge. Ophthalmia neonatorum may complicate and cause blindness. The diagnosis of gonorrhea includes light microscopy, which demonstrate intracellular gram-negative diplococci. Nucleic acid amplification tests can also be performed, such as the polymerase chain reaction. Culture and sensitivity is an important aspect of the diagnosis of gonorrhea, as it helps in the identification of specific antibiotics to which the bacteria are sensitive. This helps in upholding antimicrobial stewardship, thereby controlling the rates of development of multi-drug resistant strain. For adults, treatment is achieved by giving ceftriaxone intramuscularly alongside doxycycline due to the high rates of co-infection with Chlamydia trachomatis. For adults, it is essential to also treat the sexual partner, as they may be a reservoir for subsequent infections. Testing for pregnancy is essential, as some drugs are not approved for use during pregnancy. Among children, ophthalmia neonatorum is treated by administering erythromycin eye drops. The development of supergonorrhea is due to a phenomenon known as antimicrobial resistance. Antimicrobial resistance can be prevented by reducing the use of over-the-counter antimicrobial drugs or any antimicrobials that have not been prescribed by a healthcare provider. For physicians and healthcare providers, culture and sensitivity should always be upheld. Thank you for listening. This has been Dr. Lijoodi. Stay tuned for more videos.